Officer Kuhn. So we heard there's a suicide patient here. Is the scene safe?
Yeah, the scene's safe. They did have a knife to cut the wrist, but we can have it secure. There's a cop in there. He's gonna be with you guys the whole time, alright?
Alright, perfect. Thanks for your help. So the scene is safe, so we're gonna call today. How's it going today?
I've been better.
I've been better. What's your name?
Kenzie.
Kenzie. I'm Steven. We're with the ambulance. This is Matt. If it's okay, he's gonna get you hooked up to our monitor so we can check you out.
Yeah, that's fine.
Would you mind telling me what happened today?
Life just got a little tough.
Life got tough, huh? Okay, I'm gonna go ahead and feel for a pulse right off the get-go. So I notice I only have one patient. C-spine's not indicated here. Nature of illness, there's mental problem here with self-harm, self-inflict.
What test that?
We'll go ahead and I don't need to call for help or anything like that. We're gonna go ahead and ask her if she knows where it is. So can you tell me what your name is?
Kenzie.
Kenzie, and can you tell me where we are right now?
We're in my apartment.
Awesome. And do you know what day of the week it is?
Monday.
Monday. And why are we here today?
I was getting ready for class.
Getting ready for class. Okay. So our patient is ANO times 4. I give her a GCS of 15. And chief complaint is just a suicide attempt with looks like lacerated wrist. And so we'll go ahead and move on to the airway part. So the patient's talking to me fine, so I'm not going to go ahead and assume anything's wrong with the airway. Seems like she's breathing, skin color looks good and everything like that. Kenzie, do you mind opening your mouth for me, stick out your tongue? Okay, so her airway does look clear. She seems to be breathing just fine. Next thing we're going to do is move on to the breathing. So we're going to go ahead and check her rate. That's good. So we're now still take lung sounds. So if you could breathe in for me, nice and deep. Breathe in and out. In and out. In and out. And if you can lean forward for me, same fashion.
4 lead hooked up.
Awesome. Perfect. So I'll give her, lung sounds are clear, breathing rate is at about 12 to 14 per minute.
Pass this over your forehead so we can check your temperature.
We go ahead and have the SpO2 hooked up, and it appears to be at about 98% on room air.
Temperature is 99.6.
Okay. So for assessing the breathing, there's nothing really compromising her airway, no injuries or anything like that. Her rate seems to be appropriate. I don't feel the need to initiate oxygen at this time. So we'll go ahead and move on and assess circulation. So we've already checked the skin color and temperature. Looks warm and normal and dry.
I'm just going to wipe your finger
We
off.
did get a core temperature of 99.0. We're going to check a blood glucose right now. We did obtain a blood pressure, which was at 124/82. We did obtain a pulse rate as well with the SpO2 and did feel a mechanical pulse at a rate of 105. We do have a 4-lead hooked up. It appears to be a normal sinus rhythm, a little tacky, but not symptomatic in any way. We do have a minor bleeding on her wrist, but they seem like slow capillary bleeds. There's nothing really managed or compromising her circulation. Blood pressure is adequate, so we don't really need to initiate any sort of type of fluid resuscitation. We're going to go ahead and get an IV access with a saline lock just in preparation for the hospital, and in case anything does escalate, we do have vascular access. We got a body temperature. She's not showing signs of shock, so we don't need to treat for shock. The transport decision, we would transport this patient on the fact that she did attempt to harm herself, just to get her evaluated and make sure that she'll be safe and healthy. We move on to the D portion of our assessment. So, Kenzie, do you mind telling me about how much you weigh and how tall you are?
I'm 5'2" and weigh about 110.
Awesome. So we obtain that information in case we do need to perform any interventions that require weight with drugs and all that good stuff. We've gone through differential diagnosis as we've been approaching this. There's no need for any type of electrical therapy or anything like that. This should be nice and easy just to transport. We would take her to Madison Memorial Hospital, where hopefully she could be evaluated, possibly taken down to BHC, whatever's going to be best for the patient.
Madison Memorial, this is Ambulance 1. We're bringing in a 22-year-old female with a suicide attempt. GCS is 15, her heart rate And baseline set of vitals was 105 for the heart rate, 124/82 is the blood pressure. Her SpO2 was 98 on room air, and her blood glucose was 92. Since then, we've taken vitals again. No significant changes have been found, and we gained IV access in her right AC. Do you have any further questions at this time? We'll be there in 3 minutes. Okay, bye.